Hi, my name is Sierra Stubbs, and this is my Economics 190 Stage 5 presentation. My main research question for this presentation was whether the ACA expanded healthcare insurance coverage in the United States after it was implemented. My first article is the peer-reviewed article, and it's called The Effects of Federal Policy to Insure Young Adults, Evidence from the 2010 Affordable Care Act Dependent Coverage Mandate. The hypothesis in this article is that the provision of the ACA extends health insurance coverage for young adults under their parents' plans, and it will have the effects that are mainly concentrated in two groups: families with poorer health and families who already have dependents on their healthcare plan, so it is easier for them to add more. The unit of analysis for this study was a person year, and the time dimension is longitudinal. The research method was a survey, and it was secondary data that they used. They operationalized the dependent variable, which is insurance rates, in a binary way, with a 0 being not covered and 1 being covered. The independent variable was age, and they operationalized it by creating two groups: the experimental group and the control group. The control group is 16-year-olds to 18-year-olds and 27 to 29 years old, and the experimental group is 19 to 25 years old. The population is young adults in the United States, and the sample was selected by those who answered the survey. Next, I will discuss this article's findings. This article found that the ACA did in fact affect insurance rates for young adults, and there was also an increase in parental employee-sponsored insurance. The central estimate of the number of newly insured young adults after this policy is 938,000, which is in between the middle and high estimates that the government released before the ACA was implemented. The evidence in this article suggests that the ACA eliminated roughly one-third of uninsurance among the targeted age group with parental employee-sponsored insurance. The main conclusion from this article is that the ACA did in fact increase insurance coverage among the targeted young adults in this age group. The findings in this article are accurate and they are not misleading. The authors have a very thorough analysis of their data. They make sure to detail every step of their process. They even encourage expanding upon their findings and conducting future studies on this data. The authors encourage looking at other outcomes such as health status, healthcare use, financial well-being, and social outcomes to further enrich their data. They make it very clear that this data is very new and the study is one of the first done on the ACA, and so their results might not be as accurate as more data is collected. These findings are not very generalizable because they are specifically about American young adults whose parents already have employee-sponsored insurance coverage and now can be a part of their parents' insurance. The next article I'm going to discuss is the non-peer-reviewed article. It's titled The Affordable Care Act's Frightening Future, a Column, and it was in USA Today. It was written by Stephen T. Parent. The findings of this article are very interesting. The author predicts the future of the Affordable Care Act, exchange enrollment, and what enrollment will do to future prices of healthcare insurance. He predicts that by 2025, premiums will increase by 61% from 2016 to 2025 for individuals with family plans, increasing roughly 61.5%. He also claims that 50% or more of annual premium growth will have to be paid for out of pocket by consumers. The Obama administration predicted somewhere between 2.7 to 5.4 million people choosing to pay the penalty rather than purchase insurance. However, somewhere in between those numbers, instead, about 7.5 million Americans opted to pay the penalty. The author states that this trend will not only continue but also accelerate. Additionally, the author claims that the amount of uninsured people in America will increase from 29 million people in 2015 to 40 million people in 2025. So, some critiques of this article. It is very opinionated and its findings may or may not be accurate. It is nothing like the academic literature that I previously reviewed in that it doesn't detail the methods by which all of the conclusions have been made. The article is also misleading because it doesn't give many details as to how it came about these findings or estimates. Also, the author states some opinions as if they are facts. For example, he says, overall, the number of uninsured Americans will rise from 29 million in 2015 to a staggering 40 million in 2025, a nearly 40% increase. Perhaps the most concerning is that this will leave nearly as many Americans uninsured as there were before the Affordable Care Act was passed. By saying this statistic in the way that he does, he is suggesting that this is a hard fact that will for sure happen. Additionally, the author does not give any additional sources except for those that are already current statistics, and many of these sources are opinionated articles as well. It is not consistent with the other peer-reviewed articles because it is saying that there is not an increase in insurance coverage after the ACA expansion. Here are my sources.